Hi, I am Blame Mokas, Menstrual Health Program Coordinator for Splash in Addis Ababa, Ethiopia.
My name is Emily Davis, and I'm the Senior Global Lead for Menstrual Health at Splash.
Hi, I'm Mayuri Bhattacharjee, Senior Program Coordinator for Menstrual Health in Kolkata, India.
My name is Megan Williams, Director of Behavior Change.
Millions of girls lack access to knowledge, materials, and safe sanitation facilities needed to manage menstruation with dignity.
In Ethiopia, 67% of the girls receive no education about puberty and menstruation in school.
In India, 71% of girls do not have knowledge about menstruation prior to their menarche. And there are harmful cultural norms and taboos which affect a girl's confidence and their self-efficacy in school and beyond.
This has not only short-term effects like bullying and missing school, it can economically and socially impact her entire life.
During interviews, students reported mothers and teachers were their primary source of information about menstruation and puberty. But the information given to them about menstruation was often inaccurate and sometimes contributed to feelings of shame and stigma.
Splash works in government schools because they're often the most under-resourced and in the most need for safe water, clean sanitation, and menstrual health services. We target the social stakeholders that surround the menstruating girl. We don't just have curriculums for the students, but we also have programs that support parents, teachers, and male peers.
With over a decade of experience, our in-country teams co-design every aspect of our program directly with kids in local communities.
Together, we have the opportunity to improve the lives of hundreds of thousands of girls across the globe.